everybody. My name is Lisa Deck, as Dean said, and I was diagnosed with moyamoya disease 7 years ago. And when I was diagnosed after 4 strokes and an 18-year diagnostic odyssey, I didn't think I would be sitting here with this amazing group of experts and esteemed panelists to bring you this great information. So this is a very exciting night, and we thank you for being with us. It's my job to introduce you to the first speaker of the night. I'd like to introduce you to Dr. Christopher Ogilvy. Dr. Ogilvy is with us today from the Adult Moya Moya Center at Beth Israel Deaconess Medical Center. He is the director of the endovascular and operative neurovascular surgery at BIDMC's Brain Aneurysm Institute. And he is also the inaugural Robert G. and Jean A. Ogerman Professor of Neurosurgery at Harvard Medical School. I did practice this first. That's a lot of big words, but I hope I'm getting most of them right. Dr. Ogilvy is known nationally and internationally for his work in neurointerventional and operative procedures, and he has been a moving force in the field of neurovascular disease for the last 25 years. His research and academic endeavors are in the areas of neurovascular disease, including moyamoya disease. In the laboratory, efforts have been focused on studying cerebral ischemia in the setting of neurovascular procedures, with a recent focus on the biology of intracranial aneurysms and the use of tissue engineering techniques to treat saccular intracranial aneurysms. He has pioneered several techniques and surgical procedures and is pursuing avenues of research and clinical treatment of patients with intracranial vascular problems using endovascular techniques. Dr. Ogilvy is the past president of the New England Neurosurgical Society, and he has served as on a number of other national neurosurgical committees. He is the director of the Brain Aneurysm Foundation. He is also an associate editor for the Journal of Neurosurgery and on 7 other editorial boards. He has published extensively with over 450 manuscripts and over 100 book chapters in the area of neurovascular surgery. We are so excited to introduce you today to Dr. Ogilvy, who will be giving a research overview and talk about surgical management. Dr. Ogilvy.
Lisa, thank you very much. And thank you all for getting this together. I know it was a lot of work. Last year we had a live event with streaming. This year it's all streaming. And we hope in the future to have more events, both live and virtual. But it's a pleasure to be here. And it's a big topic to take on in 20 minutes. And so I'm going to try to go through it. And I realize the audience is quite broad, anywhere from physicians who are more experienced and into the research side of this more than I, although that's where those details are kind of where we live, and then also patients who are just trying to grasp what this thing is. But I'll try to run through a few things and sort of give a very broad overview of where work has been done, and then where we hope work can be done. The name moya moya, as you all know, it's a weird thing because it's a medical problem named after what a diagnostic test looks like. A cerebral angiogram, an injection of dye material into the blood vessels of the brain, gives this appearance of the so-called puff of smoke. And I say here that for patients and families, the puff of smoke can be a house of fire, because when people learn of this diagnosis in Lisa's situation, Corey Rapucci, other people who you'll be hearing from tonight, it's sometimes an odyssey to make the diagnosis because they're young individuals having really strange symptoms, and not everyone puts it together, which is one of the reasons to have events like tonight, to get the word out there, not only to patients, but to other physicians. This is something people learn about in medical school sometimes, but the depth of that knowledge is variable, and we'd like to increase that. This is just a picture, and I'm going to be showing some medical pictures and research pictures. I'll try to explain them on a variety of levels, but this is just a picture of a cerebral angiogram, which is injection of dye material that you see on an X-ray of a patient with moya moya. And there are gradations of moya moya disease from moderate to severe, because as many of you know, this is a progressive narrowing of the major blood vessels to the brain. And in response to this, and you see this in the lower left corner picture, that in response to this, the blood vessels in the brain in patients with moyamoya, this doesn't happen in other patients with narrowing of the blood vessels, they tend to grow little tiny vessels. And that's what gives this appearance in the lower left corner of a puff of smoke, as it's called.
Dr. Ogilvy, I believe you are muted.
Thank you. I must have hit
Oh,
a
there you
button. I apologize. This is just a picture of blood vessels in the brain trying to show what the problem is. It's thickening of the wall of the artery in the brain. And the large area, the closed arrows, the blue arrows, show what's called the internal elastic lamina, the elastic layer of our blood vessels in the brain. And in moyamoya patients, these constrict and infold. And you see the open arrow shows that there's thickening of the wall. There's too many cells there. Those little black dots are all cells, and there's too many of them. There should be 1 layer or 2 layers, and there's 10 layers. So this is what we see when you look at the blood vessels under a microscope in patients with moyamoya. And the exact problems that trigger the precise time frame and progression of moyamoya disease remain unknown. And in a lot of my slides, I'm going to use the terms remain unknown. And that's why we need research. That's why we need funding. That's why we need more people doing research in these areas. But it crosses several areas in neurology and in medicine. It's not just one area, like aneurysms are concrete bubbles in the artery of the brain. That's a totally different problem, which some moya patients can get, but it's a very focused thing. Moya, as I'll show you, crosses medical fields and surgical fields. There's several ways that the blood vessels can get to the way I just showed you. Angiogenesis is a word you'll hear. That means blood vessel growth. Angiovessel genesis growth. Genetics, as many of you know, moya can run in families and in ethnicities. And then there's a body of information growing about the possibility of the immune system or inflammation involved in moya formation. But I'll start with what's called the angiogenic mechanisms, that is blood vessel growth. Now, I'll try to keep this pretty straightforward. And on this slide, you see all these words, VEGF, FGF, TGF. Don't worry about that. Just understand that GF means growth factor. So VEGF is a very common one, vascular endothelial growth factor, fibroblast growth factor, but GF is the point. And growth factors are indeed factors that encourage blood vessels to grow. And I'm going to show you some slides where there are receptors, that is places on cells and tissue where things can land, proteins can land to trigger responses. And the reasons physicians look at things in that way is those receptors and those pathways possibly present opportunities to block a disease or encourage it. That is, block a process or encourage it. And that's how we think of attacking medically a problem like this. Here's another term you'll hear, EPCs, that is endothelial progenitor cells. This is something we really didn't know much about 15 years ago, but it turns out that in all of us, even as adults, we have cells that are made in our bone marrow that are released into the bloodstream that are little baby cells that form the cells that go and line the blood vessels that go and line the blood vessels, which are called endothelium. So endothelial progenitor cells are EPCs. And these cells are thought to play now a role in the injury and the response to injury in blood vessels. And there is some emerging information that they may be involved in moya formation. Here's a cartoon which shows the type of thing that happened, which many of you know. In the upper left corner, you see a narrowed artery. And in a patient without moya disease or doesn't have the moya propensity, a narrowed artery can get very narrow and cause a stroke. In patients with moya disease, the vessel gets narrowed. And what that cartoon in the upper left shows is all that little hairy fuzz material. Those are vessels that they're supposed to be, instead of hundreds of them, they're supposed to be 20. But in moya patients, they have the ability to sprout blood vessels, even in adults. Now, I'll show you later how we use this to help cure the patient with surgery because they have this propensity or this ability to sprout blood vessels. You can sometimes use that and trick the system and get them to sprout blood vessels that usually grow outside the head and have them grow on the brain surface. It also shows the thickening of the arterial wall that can occur in the moya patient in the blood vessel wall. And this is what I was talking about earlier. This is the blue half circle is meant to be the surface of a cell. And the little red thing sticking through it, you see TGF-B, TGF beta. These are growth factor receptor sites. And when a receptor is activated, and the little blue hair on the slide is meant to be a protein. And when these things land on receptors, things can get triggered and a cascade can initiate. You can see inside that blue half circle is the inside of a cell, and that's where cascades can be set in motion. We have here drawn the inflammatory cascade. And as physicians, we look at those cascades. There's different ways to look at them. Sometimes we can look at markers. I'll talk about biomarkers, where we can watch agents in the blood or in the brain increase or decrease. And then we can try to think of ways to block that or enhance it if it's something that's going to help the blood vessel. That's how you can manipulate the system to try to cure a disease like this. That we're not there yet with this disease, and as Dr. Lukowitz will probably talk about, the medical treatments for this are few. However, there are things on the horizon that might play into it. Well, how about genetics? This is highly suspected in Moya, although many of you and many people have isolated instances where they're the only one in their family. It certainly does run in families, and familial situations have been described. And there is, of course, a strong link with ethnicity. So this, especially these days, with the increased ability to look at the genetic makeup of given individuals, not given populations, but given individuals, just as you know when you do the test for genetic association, the test your family gives you at Christmas, and you do your tongue swab and send it in. This is getting at your genetics, and it's getting better and better. But little is known about this, but lots has been looked at. But it's a bit of a hunting expedition because you're trying to find what genes associate with a specific disease. And we also know that moya disease can associate with certain other inherited diseases: Down syndrome, sickle cell disease, neurofibromatosis. These are things which do run in families, and moya can associate with them. And here's just a laundry list of the various genes that have been associated with moya. We don't know what all these mean yet. We just have found them in certain patients with moya with increased frequency compared to other patients. And a review was done last year looking at the type of problem people have, the presentation of their disease, how they did over time, and then other factors, and trying to link certain genes to those parts of the disease. So this is where the hunt is going. And finally, I mentioned inflammation, and this is a growing area of interest. So we all know what inflammation is. Everyone's, especially with COVID and people learning about the immune system, but there's evidence for inflammation in the pathophysiology or development of moya. We see T cells. T cells and macrophages are cells in our blood that are associated with inflammation. And we see increased amounts of this in patients with moya in the blood vessels and in the tissue around them. There are immunoglobulins, which, your antibodies, the things that ward off infection and inflammation. We see abnormal deposition of that in the moya vessels. And we see upregulated expressions. That is, people make more of certain inflammatory factors in their blood in patients with moya. And Dr. Smith is going to talk to us a little bit about biomarkers, and he's measuring them in the blood, but also ingeniously in the urine. And he'll talk to you about that. But the main reason is that why the pathogenesis isn't really well understood is there's no great animal model. In medicine, sometimes we develop an animal model, and that helps us understand a disease. There have been several methods that have been attempted to make animal models, and you can do this by trying to block an artery in a rodent or an animal. You can see here, you can clip off an artery or tie it off. That's trying to mimic the narrowing of a blood vessel in a moya patient. You can do it in a genetic fashion. Certain mice strains can be genetically bred to have certain genes missing. So if we think a gene is important in moya moya, you can develop an animal that either overexpresses that or underexpresses it and use it. And then there's an immunologic attack, that is making animals sick with certain illnesses or injections to see if they get moya and moya moya. And nothing has really panned out until recently. There's been one model that has panned out, and we put it in these blue arrows, where it's a combination of using a genetically engineered mouse in conjunction with that mechanical insult, a narrowing of a vessel or a tying off of a vessel. And we're starting to see evidence in those mouse brains of changes similar to what adult and children humans get with moya moya. So there is some hope along those lines that we might have a model to help work out some of the pathways I've mentioned. And finally, in the last few minutes, I'll mention biomarkers. Biomarkers are things you can measure in the bloodstream, or in Dr. Smith's situation in the urine, that might tell us what's going on with moya moya disease. And there's certain factors that are starting to be shown to be higher in moya moya patients compared to healthy patients. And one is what's called metalloproteases. And these are agents that can be the breakdown or expression of certain parts of a cell that can be very important in inflammation and in vessel development. And we now are able to do what are called microchips. You can take genetics and really map them for different patients to try to associate who, in this situation, we're beginning to develop biomarkers that might tell us who will respond to our surgical treatments, who will respond to an indirect bypass or a direct bypass, because we don't really know that with detail. And as I mentioned, Dr. Smith will talk about urinary biomarkers in terms of how they might be useful. And in terms, how about a medicine? Are there medicines that we might be working on to help with the treatment of moya moya? To date, as you all know, there's no curative medicine, no magic pill. Antiplatelets are used in the form of aspirin. But moya moya does have the risk of hemorrhage as well as ischemia or stroke. So there's a little balance in terms of using a mild blood thinner like aspirin. But the prerequisite for medical cure of any disease is that the pathogenesis, or how it happens, is well understood. And we really don't know that at this point in time for moya moya. So that these factors that I mentioned earlier that I show on this slide, they may be potential avenues to look at in terms of blocking or enhancing to enhance or to minimize the progression or even the development of moya moya. And that's a 30,000 foot kind of look into the future. Now, surgery, you all probably know well. We call it either indirect or direct. Direct is when we simply take the artery that runs outside the head, here shown in a cartoon labeled STA, or superficial temporal artery, and or hook it to an artery inside the head, physically sew it to a vessel inside the head. And an indirect bypass or an indirect revascularization is when we take that same artery and simply lie it and suture it to the surface of the brain. And amazingly, in patients with moya moya disease, vessels will grow from that vessel to the brain surface. And here's what a superficial temporal artery looks like in a patient. Here's their skull, and you can see a side view. And this is the artery used in many of you to either hook it to an artery inside the head or lay it on the brain surface. Here's a situation where we dissect it out and can isolate a vessel on the brain, in the brain itself, as you see here in the middle of the picture, and then go ahead and cut it open and suture this artery from the outside of the head to the inside of the head. This is an EC-IC bypass, extracranial to intracranial bypass. And when the little clips are opened up, this takes about 20 minutes to put these sutures in. And after they're placed, one can see nice flow of blood from the outside of the head to the inside of the head through this so-called bypass. And then there's the indirect technique, which many of you know about, where we, again, open the scalp and dissect out that same artery, which is shown here, kind of like a worm in the middle of your field there, and then open the dura, the leather-like covering on the brain, and lay this artery onto it. And as you see here, place it on the brain surface and suture it in place. And this is what it looks like at the end of the operation, where we are able to close the dura over it. You can see the artery coming from outside of the head, goes to the brain surface, and then comes back outside the head. So there's still blood rushing through this as we do the procedure and lay it into position. And then we can replace the bone or not. We're finding that you don't always need to do that. And then once it's in place, amazingly, we do the angiogram, which many of you now know what this looks like, and you see great ingrowth of blood from that vessel to the brain surface and even to other parts of the brain. This was found quite almost by accident that this happened in patients with moya disease, but you can see really great what we call revascularizations or more blood flow over time. I'm going to stick a little more details, but even putting a burr hole, just placing a hole in the skull where this red circle is on this slide, blood vessels will tend to grow onto the surface of the brain and sprout in patients with moya disease. That will not happen in a patient with a stroke from a blocked artery from atherosclerosis, which is very, very different. So both indirect and direct techniques are effective. There's a lot of research that remains about the details of the procedures and which patients are best for each procedure. And in general, research for we've learned a great deal in the past 20 years, which is really the greatest growth of information about this disease. There's still a lot of areas to investigate. And as you can see, it's a complex problem and it crosses several fields of medicine and surgery. You know, the factors and then the flow. There's two different things. One is, as we say, is physiology and one's anatomy. So I will stop there and thank you for your attention. I don't know if people will write in questions or maybe in the discussion session we can ferret out different questions.
Excellent. Thank you so much, Dr. Ogilvy. That was a lot of information in a short amount of time. So as people are listening, I believe there will be the possibility of doing questions, in the chat on Facebook, and I think those will be monitored. So we will get to that a little bit later. So thank you again. And I know sitting here as a patient who has been through surgery, seeing it, wow, it's amazing to think of what has been done. So thank you for sharing.